when I first got out of pharmacy school, my first job, I had a board full of treatment guidelines, hypertension, diabetes, gout, headaches, you name it. I had a guideline for that, and and then of course the industry itself started doing a lot of guidelines, and then you find out that what's behind the guidelines.
Yeah, who's pushing the guidelines?
Who's
right?
pushing the guidelines?
Those?
Then you find out that it's not always on the up and up.
It's not always for the best interest of the quality of life of the patient. It would be what I would think would be the right words to say.
Right.
Yeah.
Yeah. It's more about just trying to say, okay, here's a study that we did, and here's what the statistics show.
Yeah.
So let's go with this line of thinking and this line of drugs right here. And of course, once again, you're still never looking at the root of the problem.
It's quite unusual for a man of many decades of being a pharmacist, and I didn't even realize what a clinical pharmacist was, which is hugely a big responsibility, that wants to actually talk about the fact that maybe we need to be wiser with pharmaceutical use, because it is not the safest thing in the world for everybody, and it is one of the top leading injuries and deaths in this country of properly prescribed and properly taken pharmaceuticals, especially when it gets to be what we call a polypharmacy. So tell a little bit about your history and what gave you or triggered you to kind of delve into this passion you now have to be an educator on this subject.
Yeah, well, I found myself over the years becoming what they call a truth seeker.
I love that.
What is it that works? And I read a book one time, What Works. I don't know if you've ever heard of that, but it's basically trying to get to the root of what things work in life and what don't, why they work. But a little bit on my background, I graduated from the UTC, and my next path was to decide a healthcare path, because most of my family's in the healthcare business. So I decided to go to pharmacy school, and that was 32 years ago. Well, no, actually, I got out 32 years ago. I did a residency, a specialized drug information residency. So that was kind of my passion area, because I worked at the Georgia Poison Control Center, which of course deals with acute toxicities. And what I've learned over my course of life is my drug information in this part of my life is chronic toxicities, So whereas people acutely overexpose themselves to Tylenol or whatever it may have been at the time, now it's a lifelong, improper health style, basically. Anyway, so I wanted to be in the ambulatory care area, so I actually had to create my own position at Grady Hospital in Atlanta, and it was all about saving money, showing that I could influence the prescribing habits of physicians, which I was able to do really well. And but I learned after a while that I was looking at patients' charts and making recommendations. And of course, your first recommendation, everybody's recommendation is always lifestyle first, and they give it a good 3 months, and then they move right onto the drugs, and they move on to more drugs and more drugs. And I quickly learned that I wasn't going to make a difference just making recommendations, because patients do not buy into just saying, here, you need to do this, or this will be a better way to do it. They need to be given reasons why they're doing what they're doing. And I learned that if I started my own clinics, that I could make a bigger impact, on the outcomes that they were having. But still, I would say the first 20 years of my career was focused solely on, okay, what's the right drug for the right patient, and the right dose. And is there any problems with that? See, drug interactions and not putting on too much, polypharmacy, those kinds of things.
Because you were not filling bottles with pills. You were counseling patients.
Yes, I actually, if people don't know what a clinical pharmacist is, you're more like a physician assistant or nurse practitioner. You're working under the guidance of a physician, and they sign off on what you do. But I was lucky in my entire career. I've sort of been independent. And I haven't worked in an area where they're pushing you to push more drugs. They just want you to give good, what they consider to be good health care to your patients, which in my area, of course, focuses on medications. But it really wasn't seeing that the patients weren't getting the true outcomes they needed that changed me into moving towards more of a holistic, type.
So you were seeing not the outcome you desired.
wholesale, you see numbers. You see good blood pressures. You see good cholesterol levels.
Paper.
You see better hemoglobin A1Cs.
Mm-hmm.
But you don't see a better health span. I mean, a better
there you go.
health. You just, it's just numbers, and numbers don't always equate to outcomes.
But most practitioners live and die on numbers. Don't they?
And the clinical guidelines, which I'm as guilty as anybody. When I first got out of pharmacy school, my first job, I had a board full of treatment guidelines: hypertension, diabetes, gout, headaches, you name it. I had a guideline for that, and and then of course the industry itself started doing a lot of guidelines, and then you find out that what's behind the guidelines.
Yeah, who's pushing the guidelines,
who's
right?
pushing the guidelines?
Those?
Then you find out that it's not always on the up and up.
It's not always for the best interest of the quality of life of the patient. It would be what I would think would be the right words to say.
Right.
Yeah.
Yeah. It's more about just trying to say, okay, here's a study that we did, and here's what the statistics show.
Yeah.
So let's go with this line of thinking and this line of drugs right here. And of course, once again, you're still never looking at the root of the problem.
Well, you said something, just real quick, you said something a minute ago, I think I've heard through other guests on here. It's we as a society, because we can talk about doctors and pharmacists, but we as a society have gotten to the pill, the microwave healthcare too. Fix me with the pill. I'm hurting. I don't want to be big anymore. I don't want my joints to hurt anymore. I want to sleep better. Okay, well here, fix it through the plate, or fix it through exercise, or fix it through spiritual stuff. Okay, but can we do it faster with a pill? Isn't there something you can just give me to fix me?
Yeah, get me back.
I don't want to do the sweat equity.
Everybody wants a pill answer, and while it can put a Band-Aid on the situation,
and it's needed at times.
It's needed at times, but it really is just most medications are putting a Band-Aid on the situation. And what I find is actually can do a disservice, because some people are, when they're initially told your cholesterol is high, we're going to put you on this medication. A lot of people are hesitant to take medications because they fear a side effect, or what's it really doing to me, the cost of it. And so let me try the lifestyle thing first. Well, then nobody gives them good lifestyle.
That's the problem. Yes, they try to eat a little bit more broccoli and a little bit less this, but there's no coaching on the lifestyle.
No coaching at all.
And they're going to fail. They're set up for failure, so they have to flip back into medication, because the system that wants them to have drugs is not a system that's going to help them be assisted in lifestyle management. Now, at Nutrition World, of course, we have coaches that can do that, but you also have great YouTube teachers online. We have so many options, but most people don't really access that because they need helpers.
Well, and just real quick to what you're both building at Nutrition World, my life, if I were to visit you and you were my doctor or physician and you gave me this great advice of fixing my lifestyle and eating better, because you both just said I don't have a definition of that, I also have a whole family tied to my lifestyle. I have daily routines. That is not just sprinkle in better habits. If I don't have definitions for that, that's going to run into my reality real fast, and I'm just going to give up on it, because no one else around me is going to support it. This is how we normally eat. This is when we eat. I don't go to the gym. All these things. I got 2 kids and a wife or husband or whatever, and I'll give it the best shot I can, but it's not maybe enough. And to your point, I don't have anybody like you helping me through it.
Yeah, and a lot of people though they'll give the lifestyle, which I'm putting parentheses, a go, and then it's not getting the job done. So then they go ahead and take the pharmaceutical route. They take the medication. Some of them have side effects. They don't continue to take it. Some actually don't have side effects. So it's like, okay, and then they found their answer.
They fixed it.
They found my answer. I'm going to take this medication. My blood pressure is going to get better. My cholesterol is going to get better. And not realizing that they've just put a Band-Aid on something. Oh, now I can go back to eating what I was eating and doing what I was doing, because I've got the pill that fixed it. And once again, it's the root of the problem is, I'm sure you've done 100 shows on, is just the metabolic disease that's going on in our world.
You may
processed foods.
Yeah, fixed your cholesterol, but now you got diabetes or something.
And so, I'm just going to skip ahead to my many years of seeing patients and stuff. That after running a diabetes clinic for many years, and feeling good about the fact that I was lowering A1Cs a couple points and getting them below that, either getting them close to the goal range or at least getting below that bad 9, A1C, and feeling good about yourself, you realize though that each year that went along, you were having to add on something or up the dose, or and And so it was actually a personal thing in my life that changed me the most, which was getting to that point where you're not feeling good because every time you eat, you don't feel good because you're not eating right. You're having the brain fog. You're having the weight gain. You're having the things like that. And then do you happen to know Dr. Matthew Hawley? Is that name?
Just the name. Mm-hmm.
Or there's a son and a dad. But anyway, they used to run classes, sort of the forks over knives type classes. And my sister and brother-in-law went to that. And they started implementing that lifestyle. And my sister lost a significant amount of weight. And kind of an interesting point is that her weight came down so well and her health got so much better that all of a sudden her blood pressure was great. And she went to her doctor and said, hey, do I really need to be taking this lisinopril because my blood pressure's good? I'm actually maybe getting low blood pressure. The doctor didn't know what to say. It's like, no, you get on a medication, you stay on it.
There you go.
You don't get off of it.
Yeah,
and she was like, nah, and she's decided, I'm getting off this medication.
Well,
I don't need it.
It's sad that the patient has to be the aggressor on that. But again, you and I both know that the normal traditional medical model doesn't have a bigger toolbox. They don't have as big a toolbox as you do or I do because they have no schooling in this. They also don't have any personal experience in the power of food, the knife and fork, nutraceuticals. And what you're going to bring to the table, one is, again, we have people every single day who come into the store who say, first off, I'm concerned about interactions between nutraceuticals, or what I call the green pharmacy, and my drugstore pharmacy. There's not that many, but there are some, and we need to be aware of those. You would be an expert on that. Two is, you're not going to be treating the patient, but you're going to be empowering them with information they can take back to their doctor. You can look at a person's pharmaceutical, and you tell me if this feels comfortable, looking at their pharmaceutical list and giving advice that maybe you should go ask these other questions about what you're taking, especially if they have side effects. And then thirdly is dealing with people's lifestyle. You understand, just like the story about the hemoglobin A1C, we can reach a lot of great places with our blood chemistry through the use of information coaching, discipline, helpers, knife and fork, nutraceuticals, but we need coaching. You are going to be that kind of person. And I'm so excited because I don't know of another wellness center / nutrition store in the country that has ever brought someone like you on. And secondly, I don't really know any pharmacists other than people who write books that have schooled themselves into the bigger toolbox options that you have done, Curt. So I'm just so thrilled, and I think the city is going to be just well served with the fact that you are here to help them. So, is that feel good to you? That kind of focus?
Oh yeah, I'm very excited about it because what I've been able to do. Once I learned in my own lifestyle what works, then you're able to passionately develop a rapport with your patients and tell them, this is what's going to work. What you're doing here, I straight out tell them. And my most recent place I worked was the homeless clinic.
Okay.
And so you're thinking you really can't make a difference in these homeless patients because
you did.
But you can make a difference. Now, they're not in complete control of what they eat, but they can make some choices like totally eliminating the high fructose corn syrup and some things like that, which made a significant impact. But back to my point, which was I was able to get A1Cs down 4 points. Was never able to do that with the medications, but I was able to do it when I started talking to him about lifestyle
at the homeless
changes.
clinic.
No, I'm sorry. At Erlanger.
At Erlanger, okay.
When I was at Erlanger, I was able to get people to drop 4 points.
Wow.
Once I started telling them, this is what you need to be doing. You need to be eating this. This is your healthy way of eating here. Eliminating the high fructose corn syrup, the processed foods, more natural foods. And
did you do a Coumadin clinic? Or
I ran a Coumadin clinic there too
for several years.
Oh, for 25 years.
Oh, 25
I ran
years.
I'm not bragging.
That's several.
I ran the top notch.
Several.
I ran the best anticoagulation clinic in the country.
Wow.
Anybody with problems, send them to me.
What credentials? I mean, you are the man. And I mean, again, there's no one I know that you could right now in this city or this state, you could call or go and make an appointment that can do what you will be doing at Nutrition World. It's coming up the next few days. So you will be on nutritionw.com as one of our credentialed experts that you can make an appointment with. You can come in and spend 30 minutes or 50 minutes, depending on the depth of information you need. And so I encourage all of you who have yourself, family members who, especially if you have older parents or people who are really unaware, and they're on these multiple pharmaceuticals, sometimes from multiple physicians, and their quality of life is horrible. No energy. They can't sleep. They have gut problems. They this, that, and you kind of have a feel that part of it is this. You would be the man that could help them take the next step, right?
Absolutely.
I love that.
I've spent 32 years looking over patients' medications and deciding what they really need, what they don't need. And now, ultimately, the patient makes the decision of what they're going to take and not take. And then the physician usually plays a big role in what they recommend. But ultimately, the patient makes that decision of what they're going to take and not. And so I've got 32 years experience of reviewing patients' medications, deciding. A lot of times they don't even know side effects they're having are related to those medications.
Yes, I bet.
I can't tell you how many people are taking a calcium channel blocker like amlodipine. Is they got pedal edema, they got swelling of the feet, and they're like, I said, do you have any swelling of the feet, and you ever get any headaches? And they're like, yeah. And I said, well, it's probably because you're on the higher dose of amlodipine. I bet we can get you on the lower dose, or better yet, how about let's start looking into what we could be doing in your lifestyle. There, you might not even need to be on this medication.
Yes.
And I don't know any doctor out there, when you change your lifestyle and you got everything under control, when you come back in there, they're going to force you to take a medication.
It is. And sometimes you actually get fired if you don't do what they say. I certainly hear those stories. And again, we're about out of time, but the old Vioxx debacle many years ago, where almost 60,000 people died from a drug that Merck completely probably knew about, but still marketed because profits are a strong motivation. And I really feel that you would also be able to throw up some yellow flags like newer drugs and say, I just don't feel confident with this at this point. We may need to wait some more time for more studies to come out. You are the lighthouse in the darkness for a lot of people that has never been available. So, Curt, I just am excited, passionate, and we're going to launch you to the moon and help so many individuals in this city who have concerns about pharmaceuticals. Because, I've had to come around the corner a little bit myself, getting 67 years old. Occasionally I have to do some pharmaceuticals. I'm okay with that. I don't feel like a failure like I would have 20 years ago. So, but guess what? I am so informed about and use the smallest dose possible, which, dose creates the poison sometimes. And you're going to be the person who can help. Like, if I didn't know as much as I know, or wasn't a seeker like I am, I would travel to see a person like you. So I want everybody to know that we now have a real true guru in this town for the honest pharmaceutical information. Honest.
And what I can promise you is that I treat every patient like I treat my mom.
There you go.
If I got my mom on it, or I would put my mother on it, then I'll recommend it for you. Otherwise, I'm going to give you the honest truth of what my background and my research in the studies, my conclusion that I've come to, is it worth it or not? Because
risk against benefit.
You can risk versus benefit. You can manipulate the numbers all day long.
Ooh. When
you say there's a 100% increased chance something good's going to happen, well, if you look at the studies and it went from 4 people to 8 people, it's manipulating numbers to make your product look better. And I'm. Go ahead.
Well, and we got to run out, but I've said probably 500 times in my last 20 years, a lot of the traditional medical people worship drugs. They truly have. I hate to use the word brainwash, but they don't have other options because, one, it's not an easy route to get options. You have to be a seeker like you, Curt. So at this point, we're going to run out of time, but nutritionw.com, you can go on that and look up Curt Dearing under one of our practitioner coaches. And
Curt with a C.
Yes.
Everybody wants to say K.
Okay. Yeah, that's right. Thank you. And book an appointment online, and then you can. He'll be at Nutrition World, again, 6201 Lee Highway. Most people know where that's at. And I'm just, again, over the moon. And thank you for joining us today on Vital Health Radio.
Well, thank you, Ed. Appreciate it.
All right. It is time to take a break. When we come back.